6. A diet high in fiber content can help an individual to A. Lose body weight fast. B. Reduce diabetic ketoacidosis. C. Lower cholesterol. D. Reduce the need for folate. Question 26 Answer: C. Lower cholesterol. Question 26 Explanation: Fiber-rich foods, such as grains, apples, potatoes, and beans, can help lower cholesterol. Question 27. What do the following ABG values indicate? pH 7.38, PO2 78 mm Hg, PCO2 36 mm Hg, and HCO 324 mg, L? A. Metabolic alkalosis. B. Homeostasis. C. Respiratory acidosis. D. Respiratory alkalosis. Question 27 Answer: B. Homeostasis. Question 27 Explanation: These ABG values are within normal limits. Choices 1, 3, and 4 are incorrect because the ABG values indicate none of these acid-base disturbances. Question 28. Ashley and her boyfriend Chris, both 19 years old, are transported to the emergency department after being involved in a motorcycle accident. Chris is badly hurt, but Ashley has no apparent injuries, though she appears confused and has trouble focusing on what is going on around her. She complains of dizziness and nausea. Her pulse is rapid, and she is hyperventilating. The nurse should assess Ashley's level of anxiety as A. Mild. B. Moderate. C. Severe. D. Panic. Question 28 Answer: C. Severe. Question 28 Explanation: The person whose anxiety is assessed as severe is unable to solve problems and has a poor grasp of what's happening in his or her environment. Somatic symptoms such as those described by Ashley are usually present. Vital sign changes are observed. The individual with mild anxiety might report being mildly uncomfortable and might even find performance enhanced. The individual with moderate anxiety grasps less information about the situation, has some difficulty problem solving, and might have mild changes in vital signs. The individual in panic demonstrates markedly disturbed behavior and might lose touch with reality. Question 29. What interpersonal relief behavior is Ashley using? A. Acting out. B. Somatizing. C. Withdrawal. D. Problem solving. Question 29 Answer: B. Somatizing. Question 29 Explanation: Somatizing means one experiences an emotional conflict as a physical symptom. Ashley manifests several physical symptoms associated with severe anxiety. Acting out refers to behaviors such as anger, crying, laughter, and physical or verbal abuse. Withdrawal is a reaction in which psychic energy is withdrawn from the environment and focused on the self in response to anxiety. Problem solving takes place when anxiety is identified and the unmet need is met. Question 30. Which of the following medications is a serotonin antagonist that might be used to relieve nausea and vomiting? A. Metoclopramide, Reglan. B. Ondansetron, Zofran. C. Hydroxyzone, Vistaril. D. Prochlorperazine, Compazine. Question 30 Answer: B. Ondansetron, Zofran. Question 30 Explanation: Zofran is a serotonin antagonist that can be used to relieve nausea and vomiting. The other medications can be used for nausea and vomiting, but they have different mechanisms of action. Question 31. Which of the following foods is a complete protein? A. Corn. B. Eggs. C. Peanuts and sunflower seeds. D. Primary healthcare prevention. Question 31 Answer: B. Eggs. Question 31 Explanation: Eggs are a complete protein. The remaining options are incomplete proteins. Question 32. Which of the following is an appropriate nursing goal for a client at risk for nutritional problems? A. Provide oxygen. B. Promote healthy nutritional practices. C. Treat complications of malnutrition. D. Increase weight. Question 32. Answer B. Promote healthy nutritional practices. Question 32. Explanation. Promoting healthy nutritional practices is an appropriate nursing goal for a client at risk for nutritional problems. Choice 1 is incorrect because it is a nursing intervention, not a goal statement. Choice 3 is incorrect because it is a therapeutic treatment. Choice 4 is incorrect because weight gain is an appropriate goal only if the client is underweight. Question 33. An appropriate intervention for the client with suspected genitourinary trauma and visible blood at the urethral meatus is: A. Insertion of a Foley catheter. B. In and out catheter specimen for urinalysis. C. Avoided urine specimen for urinalysis. D. A urologist consult. Question 33. Answer D. A urologist consult. Question 33. Explanation. A urologist consult is appropriate for a client with visible blood at the urethral meatus and suspected trauma. Choices 1 and 2 are contraindicated. A urinalysis might be ordered by the physician, but the question does not provide enough information to make choice 3 the correct answer. Question 34. Which of the following is the primary force in sex education in a child's life? A. School nurse. B. Peers. C. Parents. D. Media. Question 34. Answer C. Parents. Question 34. Explanation. Parents are the primary force in sex education in a child's life. The school nurse is involved with formal sex education and counseling. Peers become more important in sex education during adolescence but might lack correct information. The media play a powerful role in what children learn about sex through movies, TV, and video games. Question 35. Which of the following conditions is mammography used to detect? A. Pain. B. Tumor. C. Edema. D. Epilepsy. Question 35. Answer B. Tumor. Question 35. Explanation. Mammography is used to detect tumors or cysts in the breasts, not the other conditions. Question 36. All of the following should be performed when fetal heart monitoring indicates fetal distress except: A. Increase maternal fluids. B. Administer oxygen. C. Decrease maternal fluids. D. Turn the mother. Question 36. Answer C. Decrease maternal fluids. Question 36. Explanation. Decreasing maternal fluids is the only intervention that should not be performed when fetal distress is indicated. Question 37. How often should the nurse change the intravenous tubing on total parenteral nutrition solutions? A. Every 24 hours. B. Every 36 hours. C. Every 48 hours. D. Every 72 hours. Question 37. Answer A. Every 24 hours. Question 37. Explanation. The nurse should change the intravenous tubing on total parenteral nutrition solutions every 24 hours, due to the high risk of bacterial growth. Question 38. A client with Kawasaki disease has bilateral congestion of the conjunctiva, dry cracked lips, a strawberry tongue, and edema of the hands and feet followed by desquamation of fingers and toes. Which of the following nursing measures is most appropriate to meet the expected outcome of positive body image? A. Administering immune globulin intravenously. B. Assessing the extremities for edema, redness and desquamation every 8 hours. C. Explaining progression of the disease to the client and his or her family. D. Assessing heart sounds and rhythm. Question 38. Answer C. Explaining progression of the disease to the client and his or her family. Question 38. Explanation. Teaching the client and family about progression of the disease includes explaining when symptoms can be expected to improve and resolve. Knowledge of the course of the disease can help them understand that no permanent disruption in physical appearance will occur that could negatively affect body image. Clients with Kawasaki disease might receive immune globulin intravenously to reduce the incidence of coronary artery lesions and aneurysms. Cardiac effects could be linked to body image, but choice 3 is the most direct link to body image. The nurse assesses symptoms to assist in evaluation of treatment and progression of the disease. Question 39. The nurse teaching about preventable diseases should emphasize the importance of getting the following vaccines. A. Human papillomavirus, genital herpes, measles. B. Pneumonia, HIV, mumps. C. Syphilis, gonorrhea, pneumonia. D. Polio, pertussis, measles. Question 39. Answer: D. Polio, pertussis, measles. Question 39. Explanation: Vaccines are one of the most effective methods of preventing and controlling certain communicable diseases. The smallpox vaccine is not currently in use because the smallpox virus has been declared eradicated from the world's population. Diseases such as polio, diphtheria, pertussis, and measles are mostly controlled by routine childhood immunization. They have not, however, been eradicated, so children need to be immunized against these diseases. Question 40. A teenage client is admitted to the hospital because of acetaminophen, Tylenol, overdose. Overdoses of acetaminophen can precipitate life-threatening abnormalities in which of the following organs? A. Lungs. B. Liver. C. Kidneys. D. Adrenal glands. Question 40. Answer: B. Liver. Question 40. Explanation: Acetaminophen is extensively metabolized in the liver. Choices 1, 3, and 4 are incorrect because prolonged use of acetaminophen might result in an increased risk of renal dysfunction, but a single overdose does not precipitate life-threatening problems in the respiratory system, renal system, or adrenal glands. Question 41. A client has been diagnosed with disseminated intravascular coagulation, DIC, and transferred to the Medical Intensive Care Unit, ICU, subsequent to an acute bleeding episode. In the ICU, continuous heparin drip therapy is initiated. Which of the following assessment findings indicates a positive response to heparin therapy? A. Increased platelet count. B. Increased fibrinogen. C. Decreased fibrin split products. D. Decreased bleeding. Question 41. Answer: B. Increased fibrinogen. Question 41. Explanation: Effective heparin therapy should stop the process of intravascular coagulation and result in increased availability of fibrinogen. Heparin administration interferes with thrombin-induced conversion of fibrinogen to fibrin. Bleeding should cease due to the increased availability of platelets and coagulation factors. Question 42. Major competencies for the nurse giving end-of-life care include: A. Demonstrating respect and compassion, and applying knowledge and skills in care of the family and the client. B. Assessing and intervening to support total management of the family and client. C. Setting goals, expectations, and dynamic changes to care for the client. D. Keeping all sad news away from the family and client. Question 42. Answer: A. Demonstrating respect and compassion, and applying knowledge and skills in care of the family and the client. Question 42. Explanation: There are many competencies that the nurse must have to care for families and clients at the end of life. Demonstration of respect and compassion as well as using knowledge and skills in the care of the client and family are major competencies. Question 43. Which of the following is an inappropriate item to include in planning care for a severely neutropenic client? A. Transfuse neutrophils, granulocytes, to prevent infection. B. Exclude raw vegetables from the diet. C. Avoid administering rectal suppositories. D. Prohibit vases of fresh flowers and plants in the client's room. Question 43 Answer: A. Transfuse neutrophils, granulocytes, to prevent infection. Question 43 Explanation: Granulocyte transfusion is not indicated to prevent infection. Produced in the bone marrow, granulocytes normally comprise 70% of all WBCs. They are subdivided into three types based on staining properties: neutrophils, eosinophils, and basophils. They can be beneficial in a selected population of infected, severely granulocytopenic clients, less than 500/M3, who do not respond to antibiotic therapy and who are expected to experience prolonged suppression of granulocyte production. Question 44. A primary belief of psychiatric mental health nursing is: A. Most people have the potential to change and grow. B. Every person is worthy of dignity and respect. C. Human needs are individual to each person. D. Some behaviors have no meaning and cannot be understood. Question 44 Answer: B. Every person is worthy of dignity and respect. Question 44 Explanation: Every person is worthy of dignity and respect. Every person has the potential to change and grow. All people have basic human needs in common with others. All behavior has meaning and can be understood from the client's perspective. Question 45. A middle-aged woman tells the nurse that she has been experiencing irregular menses for the past 6 months. The nurse should assess the woman for other symptoms of: A. Climacteric. B. Menopause. C. Perimenopause. D. Postmenopause. Question 45 Answer: C. Perimenopause. Question 45 Explanation: Perimenopause refers to a period of time in which hormonal changes occur gradually, ovarian function diminishes, and menses become irregular. Perimenopause lasts approximately 5 years. Climacteric is a term applied to the period of life in which physiologic changes occur and result in cessation of a woman's reproductive ability and lessened sexual activity in males. The term applies to both genders. Climacteric and menopause are interchangeable terms when used for females. Menopause is the period when permanent cessation of menses has occurred. Postmenopause refers to the period after the changes accompanying menopause are complete. Question 46. Why must the nurse be careful not to cut through or disrupt any tears, holes, bloodstains, or dirt present on the clothing of a client who has experienced trauma? A. The clothing is the property of another and must be treated with care. B. Such care facilitates repair and salvage of the clothing. C. The clothing of a trauma victim is potential evidence with legal implications. D. Such care decreases trauma to the family members receiving the clothing. Question 46 Answer: C. The clothing of a trauma victim is potential evidence with legal implications. Question 46 Explanation: Trauma in any client, living or dead, has potential legal and/or forensic implications. Clothing, patterns of stains, and debris are sources of potential evidence and must be preserved. Nurses must be aware of state and local regulations that require mandatory reporting of cases of suspected child and elder abuse, accidental death, and suicide. Each emergency department has written policies and procedures to assist nurses and other healthcare providers in making appropriate reports. Physical evidence is real, tangible, or latent matter that can be visualized, measured, or analyzed. Emergency department nurses can be called on to collect evidence. Healthcare facilities have policies governing the collection of forensic evidence. The chain of evidence custody must be followed to ensure the integrity and credibility of the evidence. The chain of evidence custody is the pathway that evidence follows from the time it is collected until it has served its purpose in the legal investigation of an incident. Question 47. Which fetal heart monitor pattern can indicate cord compression? A. Variable decelerations. B. Early decelerations. C. Bradycardia. D. Tachycardia. Question 47 Answer: A. Variable decelerations. Question 47 Explanation: Variable decelerations can be related to cord compression. The other patterns are not. Question 48. A client comes to the clinic for assessment of his physical status and guidelines for starting a weight reduction diet. The client's weight is 216 pounds and his height is 66 inches. The nurse identifies the BMI, body mass index, as A. Within normal limits, so a weight reduction diet is unnecessary. B. Lower than normal, so education about nutrient-dense foods is needed. C. Indicating obesity because the BMI is 35. D. Indicating overweight status because the BMI is 27. Question 48 Answer: C. Indicating obesity because the BMI is 35. Question 48 Explanation: Obesity is defined by a BMI of 30 or more with no comorbid conditions. It is calculated by utilizing a chart or nomogram that plots height and weight. This client's BMI is 35, indicating obesity. Goals of diet therapy are aimed at decreasing weight and increasing activity to healthy levels based on a client's BMI, activity status, and energy requirements. Question 49. Which of the following instructions should the nurse give a client who will be undergoing mammography? A. Be sure to use underarm deodorant. B. Do not use underarm deodorant. C. Do not eat or drink after midnight. D. Have a friend drive you home. Question 49 Answer: B. Do not use underarm deodorant. Question 49 Explanation: Underarm deodorant should not be used because it might cause confusing shadows on the X-ray film. There are no restrictions on food or fluid intake. No sedation is used, so the client can drive herself home. Question 50. Broccoli, oranges, dark greens, and dark yellow vegetables can be eaten too. A. Supplement vitamin pills. B. Balance body molecules. C. Cure many diseases. D. Help improve body defenses. Question 50 Answer: D. Help improve body defenses. Question 50 Explanation: Controversy over what types of food to eat and not eat is still under investigation. Certain foods can help improve body defenses to possibly prevent certain diseases.